Welcome to the Light Cellar Podcast, brought to you by Light Cellar, a place where you can learn to find and craft your own food and medicine. In this interview series, you will meet a range of characters in the health and wellness space that are bringing light to your everyday. You'll hear from a number of different experts on a wide variety of topics. We have several different series within the podcast, including our Wild Wisdom and Storytelling with Blaine Andrusic, the Rays of Light, inspiring wellness in the community, plus solo casts, Q&As, and other topics for you to enjoy. You can find this as a video version, as well as the audio on any of your favorite platforms. Be sure to like, subscribe, and share this with somebody you know who will benefit. You can also shop online at lightcellar.ca. Oh, welcome. We've got our very special guest, Orsha Magyar, who's a holistic nutritionist and neuroscientist. She is the founder, creator, and principal of Nutrition, an incredible resource that we have here in Calgary, though she definitely does serve clients far and beyond that through online. And over the last number of months, we've been hosting her workshop all about the glymphatic system. And each time we do it, there are some incredible questions that come through that Orsha wants to give a little bit more attention and research. And so this call is about covering off some of those questions that came out of the last workshop. And we're going to dive into that. So welcome, Orsha. Thank you.
Thank you for having me, and I'm excited. I always love these follow-ups where we get to dig deeper into some of the really thought-provoking questions. So yeah, thanks for having me.
Yeah, absolutely. And I'll just invite anybody watching, if you're curious about what some of those other questions have been, where, we've spent anywhere from 10 to 20 minutes kind of diving through them, you just type it in, Orsha Magyar, Light Cellar. All of them are kind of cataloged in our archives on YouTube, so you can go and check those out. Now, for today, we're going to be talking about a particular study related to sleeping pills and dementia, as well as target breath rate, heart rate, that type of thing. So let's start there. We had kind of a two-part question. And the first was, what is the target breath rate?
That was a great question. And I didn't know it off the top of my head, so I quickly looked it up. So your target breath rate is anywhere from 12 to 25 breaths per minute. So this is important, and I recommend that you guys take a look and figure out what yours is, because it can have a lot of implications, or can also be a telltale sign of your underlying health or lack thereof. So some of the research that I found looking up target health rate suggested that it is actually the ignored vital sign. So it's actually considered by some healthcare practitioners as a vital sign, because things like stroke, traumatic brain injury, and neurological and even some psychiatric diseases change it. So this has implications and kind of goes back to the topic of our workshop that we hosted, brain detox and the glymphatic system, because conditions that affect your target breath rate also are shown to affect your glymphatic system.
Wow.
Which is your ability, to detox the brain. So I didn't know this. So I dug into it and have a kind of clear, little concise list for you. So conditions that affect the target, the breath rate by increasing it are asthma, COPD, other lung diseases, heart disease, dehydration. That is so common, and that can increase your target breath rate and therefore impair glymphatic flow. Fever. And then conditions that are shown to decrease that target breath rate, so less than 12 breaths, are TBI, traumatic brain injury, like concussion, stroke, alcohol, and narcotics. So, I work with neurological disease and mental health conditions, and I know anecdotally, and the research also backs it up, these issues are connected with breathing and respiratory issues. So they're very correlated. Sometimes the brain issue comes first and it starts to affect the breath rate. And sometimes there's a breathing disorder and then it affects the brain. So they're very, very connected. And for those of you wondering, what is breath rate? Basically, in a nutshell, the number of breaths that we take in a minute is a sign of how often your brain is telling your lungs to breathe. So things that affect that are if your oxygen is too low or if your carbon dioxide is too high. Even if your oxygen is normal, but your carbon dioxide is high, like if you have a fever, if you're fighting an infection, that will also tell your brain like, whoa, you're sick, start breathing more rapidly, for example. So yeah, something to keep in mind and to know where is your breath rate at.
Yeah, man, just as you were chatting, I'm thinking about my head, 12, like, wow, that is some really slow down breathing.
Yeah. But up to 25 and then more than that, something's going on. Yeah.
Yeah, totally.
Yeah.
And
So even like when you go to the doctor, you probably don't know when they're listening to your chest, they're looking. My friends that are physicians, they're looking. They don't tell you, but they're looking at your chest rising and they're counting that.
right. Oh, very interesting. Yeah.
Yeah.
And I'll just add to that as we're talking about breath, the idea of nose breathing versus mouth breathing. If
Mhm.
nobody's looked into that, definitely give that a quick little research. Absolutely fascinating. Ideally want to be breathing through our nose.
Yeah.
And it's shocking, what kind of the connections between mouth breathers and even just kind of like physical, abnormalities that can develop and the cascade of effects that happen
Mhm.
that way. So,
Mhm. Yep, absolutely.
okay, right on. So, our next question, and I think these are totally related, which is
Mhm.
about heart rate, right? And
Mhm.
obviously, if one's higher, the other's going to be higher as well, lower, so on and so forth. So, question was, what would a target heart rate be at
Yeah.
resting?
Yeah. So your ideal resting heart rate should be between 60 and 100 beats per minute. Now, if you're an athlete, the more physiologically fit you are, it can be lower. It can be 40 to 50 if you're a very fit athlete. But for the most of us, average humans, 60 to 100. To measure it, you simply get your pulse. So you take your two fingers like this, index and third, put it on your neck, kind of palpate around, find that windpipe, move over to the side of it, and check your pulse. You can also check your pulse at your wrist. And what you're looking for when you feel your pulse, you want to start counting it. How many beats in 15 seconds, 5 seconds? You get that number, you multiply it by 4, and that is your heart rate. And you want it to be between 60 and 100, that minute, that number. A lot of things affect it too, that kind of go back to and relate to brain detox. So different neurological traumas and disease are shown to be related to resting heart rate. So again, traumatic brain injury, stroke, epilepsy, and seizure disorders, migraines, dementia are all shown to affect your target, your heart rate. So having implications then not only for cardiovascular health, like you said, Malcolm, respiratory health, the lungs and the heart are very intimately connected. And then, yeah, for our conversation that we had at the workshop, the brain detox and the ability to clear those toxins. We have research showing that increased resting heart rate is an increased risk for getting dementia. So
Wow.
it's a pretty sobering uh, piece of research there. So yeah, guys listening in, watching, measure it, see where it's at. You want it to be 60 to 100.
Yeah. And I know meditation to be a very powerful tool to
Yeah,
help address both of
yeah,
those.
yeah.
Yeah.
Meditation, mindfulness, those sorts of things. Again, another reason why it's so great is it can help to really put it into that nice zone.
Yeah, cool. Okay, awesome. And I'll just mention right now. So if anybody was interested in that workshop, all about the glymphatic system, detoxing the brain, we now have it on lightseller.ca. Go under online courses. You'll get the recording. You'll get the slides as well as kind of a recipe attachment as well. A number of delicious recipes that are supportive of everything shared. And yeah, great resource to have. Okay, so our next one, we wanted to talk about, you had mentioned a specific study, and this is something that you were able to access the PDF for us. So thank you so much. And
Sure.
it's titled Race Differences in the Association Between Sleep Medication Use and Risk of Dementia. Let's dive into that.
Yeah, quick summary, and you guys are welcome to email me once you dive deeper into the PDF that you're going to receive. But this paper is a new paper. Came out in January 2023 in the Journal of Alzheimer's Disease. And it's a longitudinal study, meaning it went on for a longitudinal or long period of time. It followed 3,000 older adults, men and women, over 15 years. So this was quite the hefty study. And they looked at if there was any association between taking sleeping pills and the risk of and development of dementia. So this was the first study of its kind, and they didn't know what to expect. And the results were really shocking. What they found was that those who took sleeping pills often or almost always had a 79% increased risk of developing dementia. The catch here, what was really interesting to note, was this was only seen in white Caucasian individuals. And this was independent of how long they slept or what the quality of their sleep was. So this was a direct correlation in white individuals between taking sleeping pills often or almost always, and an almost 80% higher risk of getting dementia, such as Alzheimer's disease. This effect was not seen at all in Black study participants. Their risk was the same as if they rarely took sleeping pills. So this was an effect seen in the white individuals only. So then the scientists kind of went further into the statistics and looking at the data, and they realized that white individuals are taking different medications. They're taking benzodiazepines, anti-anxiety medications, twice as often as Black individuals, antidepressants 10 times more,
Jeez.
and hypnotics like trazodone 7 times more. When you start looking at how these drugs work, all of them are affecting acetylcholine, the primary neurotransmitter involved in memory that goes away during dementia and in dementia-based disorders. So there's something emerging showing, a race difference. And then what medications, and that's a whole other can of worms that scientists are going to look into, like why are they being prescribed medications differently or taking medications differently, but a huge difference in the risk of dementia.
Wow. Yeah.
Black and white. It was fascinating.
Cool. Totally shocking. And we had somebody
Totally
reach out
shocking.
via Instagram because they're like, "What? I need to see this paper." And it's like, "Yep,
Yeah.
here it is." Like, and what an incredible study! Like 3,000 people, 15 years, like you say. Like this is nothing small. This was a serious.
Because that's always something to look for, and when I talk about research, you want to have a big N or a big number, like little case studies, 1 or 2 individuals, that's cool. But that should fuel like a big study. And really, I mean, an N of 3,086, I believe, was the number, like over 3,000, 15 years. This has some legs and prompts further investigation of what is going on.
Yeah. Well, thank you so much for bringing that to my and everybody else's attention. I think this is the kind of information that could really change the course of someone's life if they find themselves, kind of in that group. And it's like, whoa, 80%. That is absolutely shocking. So
you're so welcome. And just to add to that too, you guys can dig deeper into the paper, but I found it so interesting. Like these effects are seen when you're taking these medications for longer than 5 months. Okay, if you're taking them short term, like less than a month, I don't want you to get scared or worry. Sometimes we need that short term support. Something very stressful maybe has happened in our lives and we need some short term help to sleep. Okay, so a month or less. My concern is those of you and my clients who are on these medications for 5 months or longer, it becomes a long term solution to your sleep. We're now starting to see it's going to have some side effects.
Yeah. Okay. So before we end here, I already mentioned, the glymphatic system class is successful online. Let folks know, about your work, how they might be able to reach out to you, connect with you, and work with you.
Sure. Yeah, we are taking new clients for January 2024 through our website, neurotrition.ca. You can connect with me personally. My email is orsha@neurotrition.ca, and you can come see us and be enrolled in a 3-month intensive program where we work through your main health concerns. You're using the Neurotrition RX or prescription for better brain and mental health, or you can come see me for an individual appointment. So email me and let's connect.
Okay, right on. Well, thanks again for all your time, your expertise.
Thank
Yeah.
you.
And be sure to check out the calendar for the new year, 2024. We're going to have Orsha back. She got some new topics that she'll be sharing with us in the coming year. So looking forward to it.
Awesome. Malcolm, thank you so much as always. Happy holidays, everybody.
All right. Bye for now.
Bye.
Thank you so much for tuning in. If you've enjoyed today's episode, be sure to give us a like, share this with someone you know who would benefit, and subscribe so you're up to date with all the new episodes coming out. You can shop online at lightseller.ca as well as visit us in the heart of Bowness in Calgary, Alberta.